So scenario 1, you got a 22-year-old female. She said, oh, it's kind of a bad trip, very anxious, not really violent, but just really shaken up, not looking good at all. What do you want to do? Yeah, so reassurance, you're going to be okay. Pot's not going to kill you tonight. Don't do drugs. And give them some oral benzos. Observe for a little while. That amount of observation is whatever the patient wants because they're fine. And send them home with a sober adult. Okay? There's no magic of, you got to watch someone that smoked marijuana for 4 hours. Like, that's garbage until they're okay and they've got a sober adult that can take care of them. Get them out of there. Scenario 2. So 24-year-old male with the last name of Zavalos comes in from the dance club. He's tachycardic. That's the move that Eric taught me right there. That is exactly the move. He's very confused. There's no other historians around. You have no idea what's going on. He's just weird. Yeah. So what do you want to do? Get him a pacifier. Yes. What else? Oh, don't remove the puka shells. That's where his life energy is. It's like Iron Man. You take out the battery, his heart will stop. So you get IV access, you give him some normal saline, and you get that full chemistry panel. Since he's hot, you do some external cooling. Any way you want, you just had a lecture on it, okay? And then IV Ativan. Beware of hyponatremia. That's the main thing that's going to get you in trouble with this guy. He's altered, and you don't know if that's because he's high or because he's sick, okay? So you got to separate those out.
You were saying start hot salts, possibly, without even getting labs.
If you didn't have a point-of-care chemistry panel. If you're in the middle of nowhere and it's going to take you an hour to turn around and someone is seizing in front of you and they're 22 and just came from a club, don't wait for the sodium to come back from the lab because you're going to have really bad brain stuff from that. And the odds of them being hypernatremic, not likely. At our shop, we've got point-of-care chemistries that you can have realistically in the next 10 minutes. So honestly, you're going to get that lab result before the hot salt even gets to the bedside. Okay, so locally, absolutely, you want a point-of-care chemistry panel. But I want you guys to be ready for if you go out in the middle of nowhere and there's a long turnaround for drugs, or for labs rather, and someone comes in as having a seizure like that, I would consider it if it was the right scenario for a young person.
We mark it like soul pacifier.
Yes, exactly. That's how you. It also decreases likelihood of them biting their tongue. This is perfect. We'll attach an LMA to it. It's beautiful. All right, scenario 3. A naked young man of unknown age, because turns out if you're naked, you can't carry a wallet. He's found in the street by the cops. And, of course, they said, he's too sick for jail. Let's bring him to the emergency department, like you do. He's fighting and screaming with police. What are you going to do? Anybody? Ketamine, maybe. Put some pants on him. A good man. Yeah, that's the first thing. So he's a danger to himself and others. You could do benzos only IM if he's not that violent. I would actually probably push more towards ketamine, okay? Or go to intubate if needed, okay? And that's an entire gradation. If they're a little bit violent, but you can settle them down and you think you put them in leathers and you walk away, it might just be high dose, IM Versed would be fine. It might be, though, that they need more like ketamine or even to be intubated, okay? Once you decide that decision that you're going to do something like that, you do a full court press for looking out for what's going on. You get all the labs, okay, all the electrolyte stuff. You're going to get tox screens and ethanol levels and all that. Once you have decided that someone was that kind of danger, is not the time to be like, you know what, I don't know if we need an electrolyte panel. He just did drugs. Like, don't do that. You need a full workup.